To meet all the audience here and to have on my right the famous owner, Mr. Cartier, Dr. Cartier. And today you will have the pleasure to see this device, Multifrax. This is a new device, and you will have the opportunity to have the plastic surgeon and the dermatologist who are the most interested specialists in using this technical device to comment the treatment. Today we'll have, it's interesting before start to show how you can work with. This is a laser, this is a battery. The laser is around 300 grams, the battery is 400 grams. Normally I put the battery in my pocket, and first starting, the device has to be set. This is very little device, but is very powerful. Two wavelengths, binary, means together contemporary. All right, this way. Perfect. Okay. Yeah, perfect. So, what you can set. This is the first wavelength. It's the same as Fraxel. This is a direct laser, but the wavelength is the same of Fraxel. So we can start from 0 and go up to 50. 50 is very, very powerful. This time we'll start 20. Okay, going to the second wavelength, 9027. We know this wavelength as thulium. So we can go up to 15, very powerful. This time we stop at 3. After what we can set, it's very easy. It's like an icon. We can set the treatment area from 2 millimeters up to 14 millimeters. We'll set up on 1. And the density of the treated area from 0.5 to 2. We set up around 1. Okay. So this is normal parameter. Here you have the counter, the tip. I mean, there is a tip I cannot detach now, but normally it's magnetic, and it's around 500,000 spots. And now that we use a tip for the 44%, we have 56%, and the counter will count every positive hit for both wavelengths. What about the tip? Yes, the tips I will show you after when you finish. This we can touch, detach, and retouch is magnetic. And this has this little roll. Why? Because the laser works only if it's in contact with the skin. And normally you can use 90 degree or also a little bit less. You can see it. Yeah? And if you don't touch, of course it's not working. So what does it mean? You don't need goggles. Nor you, nor the patient. Exactly like Fraxel. So, having this device, you use in this way, in opposite, so is bilateral. So, starting the treatment, I would like to emphasize one thing. This is the device, this is a laser. Normally, we have a handpiece, and the laser is here. We don't have laser here. Big laser. Normally, we have a machine very fragile, because you can broken this, the cable, the machine. Here, you must be careful not to have this down. And you can carry in your pocket from one room to another, from one office to another. Exactly, for plastic surgery. Yeah, because dermatology normally has a big office, and plastic surgeons move with the bags from one to the other to operate the theater. And also,
maybe we can have a discussion about our point of view. How do you use it? What for? But I know that for them it's okay. We have many devices and we stay in the same place. But even sometimes we work also at hospital. Okay, but for you it's very interesting. I like this kind of ultra portable devices to daily practice for such surgery. Do you think you have to use? Do you need to be a doctor? You need to supervise?
in our, it depends where you are, according to the law. This, in some country, is also nurses are allowed, not medical doctor. In our country, in Europe, it's only medical doctor. But if you are allowed to delegate, this is completely delegated. Why? Because it's very easy. Of course, it's a hand technique, so it's not a machine, it's not a scanner. So you will see in different ways, but it's very easy to do.
The learning curve is very
It's very easy. The most important thing is to set up the parameter. But we have tables, very complete set.
Which indication for you first?
Yes, the indication for plastic surgeon, scars is very useful. Why? Because we can treat red scars as soon as we have a red scar with the 1550 nanometers and also with the lit power of 1927. If the scar is mature, so it's pink, it's finished, we can treat with more powerful both wavelengths, 1927. You can have 4, 5, 6 millijoule and go up also for this. It's not ablative, but both, if you use 10 millijoule or more than 10, it's quite ablative. So you will see the little spot on the scars. Of course, you have to treat more than one. So if you do a CO2, you have less treatment, 1, 2. With this, you have 2, 4, 6, it's depending. And also it's depending from the level of the pain you want to. Normally scar, not very painful. Yes, scars. But of course, you can have wrinkles, not ablative skin resurfacing. You have also the irregularity of the skin and the color.
Okay.
And there is a special protocol developed in Asia for melasma.
Yes.
Melasma, it's
skin phototype. Yes, eye phototype, because you can reduce or increase the fluence very easily, and for dark spot or many things. For me, my favorite is for acne scar.
Yes.
Okay, it's easy. But sorry for that, but I treat a lot of scar after
surgery. Yeah,
sometimes they impatient, or sometimes they use, you have laser. I say, no, you can change, maybe no. You can buy this device and follow your patient for all during, after your surgery, lifting, or abdominoplasty, mammoplasty, reduction. So really it's interesting for plastic surgeon. For them, yeah, we know very well the two wavelengths, thulium and 1550 is very common, because as you know that Nicolai was the inventor of the Fraxel more than 30 years ago. Okay, so it's interesting that Nicolai Tankovic, yes, sorry, he gave a lecture tomorrow afternoon.
I think he's in the audience.
And you can listen him, because it's very interesting. He was a doctor. He's coming from Russia. He exported to USA, and he developed patent for depilation, and since more than 30 years, non-fractional laser. And he started with a Fraxel device, and now he minimize the device, so it's not a gadget.
No.
Not a gadget.
Not at all.
Okay, so some patients say, it's a gadget. I said,
some surgeon, some medical doctor.
Yes.
Trying to have very
you see a market.
Yeah.
Yeah, for us.
Market, it's a FDA market. It's presented quite worldwide. Also in the eastern part of the world. So this is, how use? It's really easy. Start with 3 second calibration, and when the point will start this color, you can start. So what's happened? I will treat this area, I will show. If I am slow enough, okay, the color is correct, no changing. You cannot hear the little sound, but if the speed is too much, start to becoming red, you see? And after, the sound is changing. What does it mean? It means then you are too fast. This is working, no changing the emission, but you are not regular in the treatment. So it's very easy. Normally we start, of course you can start here anywhere, so this area, and we do from 1 to 3 passes, depending for, we can do this way.
Yes, you have 2 directions.
2 directions, very easy. And this way.
You need fan?
I don't know, you need fan?